Since December last year, the outbreak of COVID-19 has infected more than 130,000 cases around the world. 2 days ago, World Health Organization declared that the outbreak as a pandemic. It means that the disease spread worldwide. And today, the World Health Organization representative to Thailand has talked to Thai PBS World tonight of how to understand the context of the outbreak as a pandemic and how individual and community should be prepared.
When we look at countries around the world, and I think it is distressing to see the virus that causes COVID spreading around the world, we tend to think of countries as falling into one of three categories. We call them cases, clusters, and community. So there are a number of countries in the world, many in fact, that just have sort of one or two cases, and mostly those cases are imported from other countries. And that's where Thailand was 6 weeks ago, 8 weeks ago. Then we have countries that have transmission in the country, what we call local transmission, in transmission chains or clusters of people, much like we're seeing in Thailand today. So I think the important thing is that in Thailand we're still seeing cases. We're still able to follow most of the cases, able to link them to other cases and to follow their contacts. The final category is community, and that's when the virus starts to spread in the community. We don't know where the virus is coming from. It pops up here, it pops up there. And there are some countries in the world that are currently experiencing that. We see what's happening in Italy, we see what's happening in Iran, and we saw what was happening in China. The most important thing is to do everything we possibly can to prevent or delay the spread of COVID-19 in the community.
Despite what you say, I think we still can afford to be complacent about it, right? Because the cases that have been reported so far, some people say could be just the tip of the iceberg.
Absolutely, absolutely. In fact, we must do the opposite of being complacent. We must redouble our efforts everywhere, everywhere, to try and identify cases. I mean, the real key is identifying cases quickly, isolating them as quickly as possible, treating them appropriately, and then tracing their contacts. The faster you can get cases who start to show symptoms, the faster you can get them isolated from other people, the less chance the virus has of being transmitted from person to person. This is what we must do. We must attempt to interrupt the transmission or stop the transmission of this virus.
So what we saw the practice in South Korea, in which they check from people who sit in the car and have all the medical equipment ready to check people. So that must be the right way to identify on the spot quite fast.
Absolutely. I think Thailand has done a very, very good job of testing people who have traveled, who develop symptoms, who've traveled, who've been in close contact with people who've traveled, and people who are in professions that might bring them in contact with tourists or people that have traveled. The more testing we do, the better, because it allows us to identify cases quickly, again, isolate them as quickly as possible, stop the chains of transmission. If we can stop chains of transmission, we can prevent or delay the virus from, we can delay a situation where the virus is spreading in the community. And as I said before, there are many, many countries in the world that only have a few cases or clusters of cases, and they have a great opportunity if they apply these measures very quickly, these public health measures very quickly, to stop or prevent or delay the onset of community-based transmission of the virus.
Now, with the sudden spike in the number of cases, including many deaths, in hindsight, do you think the World Health Organization should have declared the epidemic, raised the level to be pandemic earlier?
Yeah, we hear that a lot, and it's a good question. But in fact, as my Director General has said, the pandemic, the declaration or calling this a pandemic changes absolutely nothing. It does not change our approach. It doesn't change the way we approach it. It doesn't change how aggressive we are. Again, it is absolutely critical to to remind countries and remind people that a vigorous public health response is absolutely critical to delay the onset of transmission in the community. It's so important that we do that, because what we want to try to do by avoiding or delaying the virus becoming widespread in the community is to sort of delay what we call the epidemic peak. So imagine if that you have suddenly a large number of cases very quickly, your health system rapidly becomes overwhelmed, okay? But if you're able to apply these public health measures, if you can slow the onset of the peak, it allows the health system more time to prepare, and it eases the burden on the health system. You don't have that sudden increase in cases, which can quickly overwhelm the health system.
Today we see how world celebrities and world leaders, some of them have announced that they got infected from their loved one or their close one. What's the recommendation you'd like to tell all the world leaders as well? Because they have to be role model, but some of them somehow perhaps refuse to stop shaking hands, for example.
I'm personally affected because the wife of my Prime Minister, I'm a Canadian, the wife of my Prime Minister was diagnosed as having COVID-19. I think we all have to be role models in this situation. I think we all have to, especially our leaders, have to transmit messages that are factual, evidence-based, based on science, calm and reassuring, and they have to not only model, they have to model good behaviors for people. And again, it's those basic things that I talked about, the hand washing, the not touching the hands in the face, the social distancing. These are really important things and very, very important things for leaders everywhere to model.
Yeah. Dr. Daniel, you must have been through the last pandemic in 2009, H1N1. What's the difference between COVID-19 and H1N1?
Yeah, I've been through, with many of my colleagues, I've been through a lot of epidemics, and they all have similarities and they all have differences. I think one of the realities of the world we live in is that any infectious disease anywhere, any new infectious disease, any emerging infectious disease can be in Thailand one day and in Paris the next day. So the world is very small, and these things spread, these things have the potential to spread very rapidly. That's the reality of the world we live in. On the other hand, I think there's a lot of reason to be hopeful. I mean, we knew nothing about this virus 8 weeks ago, and the amount of knowledge that we have accumulated has advanced at the speed of light. I mean, we already have, there have been over 150 papers already published on the virus that causes COVID. Our knowledge is expanding every day. We now have networks of clinicians, infection control practitioners, scientists, epidemiologists working around the clock, communicating with each other all around the world. So we have an unprecedented global capacity to respond to this epidemic. So for that reason, I'm optimistic.
You know that April is the festive season for Thailand, and Songkran holiday is around the corner, and this is posing a big concern for health authorities. So what would you be advised to Thais? I mean, tens of thousands of them are now planning to go back to their hometown, so celebrate Songkran. A mass movement of people.
Right.
Because so far, all the cases that have been reported are confined to Bangkok and metropolitan areas, right?
Sure. Again, I think there's some important lessons to be drawn from China here. I think it's really important that the capacity of public health officials in all of the provinces of the country is strengthened to be able to identify cases should they occur. And again, isolate them as quickly as possible, treat them appropriately, identify their contacts, and trace their contacts. That's how we deal with a situation where we have 1 or 2 cases in a community. So as people in Thailand spread out across the country, public health officials in the places where they're going have to have the capacity to be able to identify cases should they occur and interrupt the chains of transmission very, very quickly, deal with those cases very, very quickly. The second thing I would say, so that's for public health officials and the public health system. The second thing I would say, again, is that every person, everywhere in this country, at every single moment has to be aware of what they can do themselves to prevent infection in themselves and protect other people around them. It's the 4 basic measures. If people, when they travel, can be careful, can wash their hands, use proper respiratory etiquette, avoid touching their faces, and try to keep a distance of at least 1 meter from other people, that would offer significant protection and reduce the chances of seeing this virus spread in Thailand.
Yeah.
Dr. Daniel emphasized again and again that we really have to wash our hands and keep distance with the person next to us, at least like 1 meter. That will help a lot to prevent the transmission of COVID-19. And that's all from Thai PBS World tonight.